So I'm going to show you this interesting case of SI joint infiltration. So the traditional method of doing SI joint is you just go, that's the SI joint over here, um, the sacral part, the iliac part. And that's the SI joint over here. This is quite deep inside over here. This is SI joint. And these are all fibrous tissue. There are a lot of ligaments over here. So the traditional method of doing SI joint infiltration is that you go contralateral oblique and you target this capsular part of this SI joint. You have to go like this and you see this joint over here. That's the capsular part, lowest end of the SI joint. And then we go inside and we um, inject it over there, right? This is, now look at this. When we remove this, this is what we target, this part of the capsule, right? And then this is how it covers the entire capsule, the SI joint. Yeah, right? So this is a traditional method. But at times, what happens that we we may not be able to enter over the joint. This, I think, most of us have encountered this kind of issues because of some difference in the some changes in anatomy, or because of the severe degeneration, or because of some osteophytes. The multiple reasons are there. We may not be able to enter over here, and then we keep struggling to enter into the capsular part of the joint. So in this case, this is a slightly modification. What we have done is that we go ipsilateral oblique instead of contralateral oblique. We go ipsilateral oblique. What we have to identify is that this is a very simple method. I'll just show you that procedure also. You just have to identify the iliac crest over here, the PSI sign, and posterior superior iliac spine, and you see the depression over here. So this is the lowest part of the iliac crest over here, and you see the depression. And just below this depression, this is the one which we see on the fluoroscope. You can easily make out this. Okay, you just have to identify this depression over here, and just below that we have a capsular joint over here. So this keeps your ilium bone away from this, from the joint. And at times, if you have big osteophyte over here, that also goes away from the in this position. So this is ipsilateral oblique position, and we can enter inside here, and then we can see the. So when we see this on the fluoroscope, we'll see a big SI joint like this. You can see both the joints because we are being ipsilateral. So you can see both the joints. The posterior joint over here and the anterior joint will be somewhere over here. So you'll be seeing it like this. Okay. Now I'll show you this technique, what we just did. So this is the one you can see over here. So look at this. So this is the ipsilateral oblique. You can see this is the iliac crest over here. And if you follow this, if you can follow, see this, and you can see this is the depression, what I was telling you over here, this depression over here, and just below that is the SI joint, the lowest part of the SI joint. Look at this. What you can do, you can, because most of the patients are osteoporotic patients, old age patients, so appreciating these bone over the bones are difficult. So in that case, what you can do is you can just reduce the voltage of this kVA of the C-arm, and then you'll be able to appreciate this. You can see there's a depression over here. That's a joint over here. This is how we are going inside. Now I just entered inside. Now because of this vacuum phenomena, the moment you enter inside the joint, because of the vacuum phenomena, it sucks the gas from outside or the air from outside. And you can see this, it is suddenly, there's a change in the inside the joint. That's opened up. This is the contrast. Now you can see here. Also, if you look at here, if you can see, this is what I was telling you. This is middle joint over here. And you can see the other joint, the little joint also over here. So this is a very big joint over here like this. You can see both the joints clearly, the dorsal joint and the ventral joints. When we get contrast over here, now you can see here the contrast is covering the entire joint over. That's the capsule of the recess of the SI joint over here. There's a lowest recess, and this is the joint over here. You can see now clearly the entire joint over here. Now we are going contralateral oblique. Now we can see that after injecting over here, now I'm going contralateral oblique just to see that, confirm that we are in the joint space. And now we can clearly see that it's within the joint space. Again, I will show you with the AP view, and then we will be able to get this after injecting the medicine. So that's the AP view. Now you can see after injecting the medication over here. Now we can see this entire joint. So this is another method of doing this SI joint infiltration whenever you have a problem in going contralateral oblique. If you're not able to enter inside the joint, in that case you can go ipsilateral oblique. What you have to identify is this depression over here. Identify this depression over here, and just below that is the joint over here.